Hi, my name is Sonia Pulido, and I'm a Mexican woman from Chicago. I am a medical student at the University of Illinois College of Medicine, and together we can elevate med. I decided to pursue a career in medicine after learning that multiple family members avoided seeking medical care for multiple reasons, including speaking English as a second language, embarrassment about not having the funds to pay for medications, not having insurance, having the concerns previously dismissed by the physician, and overall feeling inferior at their appointments where no one on staff came from the same background as them. But what I want to emphasize is that these are all barriers to accessing medical care and have hurt people. And as a future doctor, I want all my patients to know that I'm a person who cares about their health, regardless of their background, and I'm here to make a positive difference and serve without judging. As far as specialization, I have loved neuroscience and working with neuro patients for a while now. In undergrad, I was a neuroscience major and volunteered at the Shirley Ryan Ability Lab in Chicago for over 2 years. There, I helped patients relearn how to walk after stroke or spinal cord injury. And I also helped out with a neuromodulation research study that applied non-invasive stimulation technology in an effort to promote the recovery of voluntary motor function after a spinal cord injury. And in medical school, I've enjoyed my neuro rotations, and I have shared my enthusiasm for the field with fellow students by hosting dinner with residents and walking through basic neuroanatomy at separate sessions as president of the student interest group. And I have led and learned from several research projects that have only further fueled my passion for the field. I'd like to share a story about my time as a volunteer. So one time I witnessed a patient clinging onto her resident doctor, begging her to spend more time with her, and I quote, "because she is like me." The resident, I remember watching her smile, and she spent extra time past her shift to reassure that patient that she would return the next day. And so that resident doctor inspired me to practice patience, respect, and kindness in all my future interactions, just as my education at Loyola University Chicago taught me cura personalis. And so this commitment to excellence and dedication to meeting everyone with dignity and compassion, I think can make a world of a difference to ensure that people felt heard and understood. This is especially important for underserved populations to know that their life matters and that there are doctors who look like them and are willing to really listen to what they have to say and to care for them. I am aspiring to become a stronger leader in medicine, and being a part of the ElevateMeD program will place me in an environment of determined, like-minded people who work together to create a better future in healthcare. The connections that I make and the lessons I learned from ElevateMeD will positively impact how I practice medicine from years now. And I think that my background, life experiences, and knowledge of healthcare disparities could add a lot of value to the program. And so to the donors and supporters of this program, and to anyone who is watching, thank you very much for your time and for your consideration.